Anniversary Celebration Dialogue Series, Research That Touched Lives. To those joining us for the first time, this is a dialogue session hosted by the Clinical Investigation Center in conjunction with the anniversary celebration. In this session, we feature researchers who will share how their research makes a difference in our community. Today, we are honored to have with us Dr. Beh Hooi, Family Medicine Specialist from the Department of Primary Care Medicine, which are also familiar with UMMC, who is also a senior lecturer at University Malaya. Since 2020, Dr. Beh has spearheaded telemedicine services at UMMC, training staff and ensuring high standards in virtual consultations. Her work focuses on expanding digital healthcare to improve access for patients and embedding telemedicine as sustainable and equitable part of healthcare delivery. So before we start, let's have a glance on today's topic, from evidence to action, advancing telemedicine in healthcare system through a video prepared by Dr. Beh and her team. So that's a very interesting video introduction giving us the idea of telemedicine in UMMC. So without further ado, let's hear from our guest. Please join me to welcome Dr. Beh Hooi. Alright, good morning, Dr. Beh. Thank you very much for joining us today. So to start off, maybe because we are here, we may be familiar with when we hear about telemedicine, then we will think about online consultation. So maybe a doctor can explain on what is telemedicine really means and how UMMC had first embarked into this journey.
Yeah, thanks, Ms. Malika. So thanks, Malika, for the nice introduction and also the nice video prepared by my team. We actually won prizes for this video creation for last year, I think CIC event as well. So what you mentioned was like, what is telemedicine? So actually telemedicine is a wider definition, is a wider term for whichever that healthcare providers can actually provide the services through online, so it can be through the technology communication platform and all that. So, but teleconsultation itself that we are actually still hearing is actually teleconsultation is like what we see patient through the screen. So meaning that you don't need to come to the hospital, you don't need to be physically present here, but you can just through the Zoom or Google, then you can see the doctor through the screen. So that's what we call teleconsultation, which is under the term of telemedicine. Yeah. So why we first started, I think it was back in 2020 when I first joined the team. But I think the team was actually started back in 2019, just right before COVID pandemic days. So that time I think it was organized by, it was started by multidisciplinary teams. Luca is one of it. Then endocrine unit, nursing, even the legal team as well, medical team, so also our MRU as well. So there are a lot of teams that involved in creating this service back in 2019. Yeah.
Thank you very much for the introduction. So, yeah, as you know, it really started to be executed fully as during the pandemic time. So, what actually is the difference from the telemedicine and also from the usual clinic visits?
Usually patients also will be very interested to know. They say, oh, usually I just tell them that you only tengok doctor through the screen. Pakai datang ke hospital. Yeah. So some of them they will be very excited, but some of them they say it's okay. They still prefer face to face. So there are two groups of patients. So let's say sometimes especially for working adults, they will actually prefer teleconsultation because you can actually no need to look for parking, no need to stuck in a jam, which is shown in the video, which is so much easier. So sometimes working adult, they're actually very interested to join teleconsultation. For those that adult, they are bringing their patient, their parents as a patient, they also prefer to do teleconsultation. Yeah. But compared to face, meaning that patients still have to come to the hospital, still have to come here, wait for the doctor and all that, to see doctor face to face. Sometimes patients, I do have some patient pensioner, they say they are quite free. They don't have anything to do at work, at home. So they kata nak datang lah, they just want to come to check with other patients. So sometimes they prefer to come, but of course certain services still benefit for certain group of patients. Yeah.
That's that we can see that there's actually a very significant benefit provided to the patient. How about the healthcare staff itself? How the telemedicine benefit the healthcare staff?
I would say for doctors ourselves, because I think first everyone a bit resistant and a bit worried because nobody had done this before. So they're a bit worried also how do I see patients through the screen, how's the function, the technology part is another challenges, and of course the safety and all that also another challenges. So those are the things that the doctors might be resistant to begin with, but because providing some workshops, training and all that to the doctors, which I've been doing ongoing every year, so those are things that actually can try to increase the doctors' confidence level. And including our nurses also, we empower them, all the doctors and nurses working closely together to actually try to have this service ongoing and smoothly.
Because it's actually a new, it's kind of like a new system, right? It's introduced not only to the patient but also to the clinical healthcare staff as well, right? So, Dr. Beh had mentioned about the safety of the patient. So, maybe you can share with us how actually UMMC healthcare staff ensure the quality and also safety of the patient while implementing the telemedicine.
That's a very good question about safety. Because when talking about seeing patients and all that, safety is the most important component. So what we ensure, the first thing will be the data safety. So meaning that whether it could be some third party actually got a link and then go and see the patient through the screen or not before giving the doctor access to it. So we try to avoid that happen by actually having the system only can be accessed in EMR through our electronic medical record in EBUM. So meaning that the doctor cannot see patient dekat rumah lah, so they cannot see patient from home. They must be here, the doctor must be here, log into the computer in the clinic, then only they can actually see patients from there. And then the patient also have their own application, the My Patient Journey app. So they have the Patient Journey app where the link will be actually sent to the patient in their apps as well. And that link also cannot be shared to others. So they can only click on their link itself and they can see doctor through the screen. So that's something that we try to ensure the data safety. And also we do have like what we call like consent form as well. So before we recruit the patient have to sign up. So we have to explain to the patient like what is the process about, how does the telemedicine, this teleconsultation going to be conducted, the processes and all that. So we will explain to the patient, and the patient have to agree and sign on the consent form. But student only they can be recruited in the telemedicine. So from there itself, patients sort of understand what is the whole process and all that. And we also usually advise both parties shouldn't record the session unless for research part and proof and all that. But of course, during usual, even in our face-to-face also, we don't really allow patients to capture video and all that. So those are things we try to explain to the patient as well. So those are things that we try to ensure safety. Of course, the other thing will be the clinical safety itself. So let's say patient, suddenly they tell you, if let's say through the Zoom platform, they suddenly tell you, I got chest pain. So what should I do? Yeah, so those are things that we also have to be careful and beware. If patient do complain of certain emergency, symptoms, chest pain or any new symptoms, we should actually ask them to come back straight away. Or if there's an urgent, then they have to go through ambulance and all that. Yeah, so those are things that we couldn't really continue to go through the screen itself. We cannot advise the patient to CPR, CPR on the screen. So those are the things that is a bit impossible. So they must come back to face as well.
So it means that this telemedicine is actually not to replace the hospital care as a completely, but it's rather like a complementary to the face-to-face care. So it more implemented in terms of like for the routine checkup, also for quick advices.
So like I said from the screen, from the video just now, you can see that we mainly so-called cater for those with chronic diseases. So we have diabetes, hypertension, cholesterol and all that. So with certain blood tests that will be done routinely, like every 6 months and all that, so you can actually see under telemedicine as well. Yeah.
It's very good to know. That, and also you have mentioned that they'll be involving like a high-tech technology like patient journey and so how is actually the acceptance for our patients here, and also how like as a doctor or clinician, how do you like train or for instance give assurance to the patients that these services actually do good and also easier for them?
That's a very good question because how we actually started to improve the uptake, it was actually through one of the quality improvement project that we did in Luka. So it was actually just purely we wanted to improve the uptake because when you look at the number of every week, every month, the number of uptake is very sad. Last time it's like less than 100 per year. It was like very little, very few patients were actually taking the uptake from the teleconsultation. So we try to have the quality improvement project where this video is one of it. So this video actually portrayed in all the TV and on our website as well. So sort of to improve awareness and also tell the patient we do have this service. So from there, usually we will, so for the QIP, the quality improvement project, one of it is we actually patient complain that go through website is a bit difficult. Last time it was actually from website. Patient have to log into website, all that is difficult. So that's why we discussed with JTM. So JTM also did a very good job. So they have this application where the patient can just click in the apps and then they can see doctors. So it's something quite easy and more feasible. Because website, sometimes patients have to go to their website, then it will be more difficult for patient. So this is one of the improvements that we did. Yeah.
So that's actually a multidisciplinary action from others as well. How about a patient, elderly patient? How do their acceptance and also how do you manage with that?
Yeah, actually true. So when we mentioned the topic was like evidence to action help, so we actually try to improve. We do have a research grant to actually run this project as well. So to actually try to improve the overall uptake of the teleconsultation in UPA and in UM. So what we had was we actually sort of having ask the patient, especially for elderly patient. So we actually try to also teach them, if let's say they do interested to know, so we do have doctors and nurses to actually guide them how to actually download the apps and all that. Then they will just need to click on the link. Because it's quite simple, just click the link. So we try to, if the elderly patient are really keen to join, provided they must have a smartphone also lah. Yeah, so if they have smartphone quite okay, then we can actually guide them. So we try to help as bigger group as possible.
That's good to know because sometimes like our parents or elderly sometimes came along, they might not have any guidance for them. But rest assured that we actually have a staff that we train to guide them as well. That's good to know. So I believe like what Dr. Beh mentioned just now, there are several research about this as well, and I believe there are several that still ongoing research. So for touching on that, what do you think is the key challenges in this research that we are currently suffering from?
I think all research or any of the quality improvement project will have some challenges. So of course first it could be in the financial itself, but good that we do have some research grant where we can actually sort of have this run through smoothly. Of course sometimes for the patient recruitment or the doctor's recruitment might be a bit slow. Like I say, we try to contact a group of patients, but sometimes patient might not have enough time, even the doctors also quite busy, so they couldn't join the study. So those are the challenges in terms of equipment. So for the process itself also, because if you were to get the proper time and then to interview the doctors and all that, so that would be a challenge in terms of that. Then the other thing would be we try to have the intervention. So we wanted to build even more catchy video, more better flyers, better posters to attract more patients. So those we also need like multidisciplinary team as well to sort of helping with the process and the promotion of the services as well. Yeah, so I think those are things that we need to consider and try to actually improve it time to time.
So, or maybe we can share what maybe we just one research that particularly involves telemedicine that is currently ongoing, so that our maybe staff and also patients can aware of the research.
Yeah, thanks. Help me to promote a bit. Okay, so I think when my friend asked me what are the research that I'm doing for telemedicine, I was like, I'm trying to squeeze everything for the telemedicine. So including from surveys, including like qualitative studies, like interview the doctors and patients, and even for implementation strategy, implementation science studies. So you try to implement and improve it. So one of it is we actually wanted to have even better intervention to actually try to improve the uptake and also recruitment for the teleconsultation. So of course, the doctors and the patients' face is already completed at the moment. So we are analyzing the data and we can see the data is quite rich. I can share a bit later. Then of course, there are a few more that I'm doing is one of it is application using certain adherent apps. So those are things, if they say we do have staff or many staff like for staff who are actually having chronic diseases. So if they are keen to using the app, you can actually also sort of can contact us as well. We do have a lot of posters on this one available. Then you can actually have to contact our research team to sort of join the study. Yeah, so those are the things that we are doing.
It's good to know there is actually a continuous effort in improving our telemedicine system.
And I think for digital health unit also, we are working closely with them, with Proc and Proc Azura team as well, that we are going to have some patient satisfaction survey as well to look at whether how satisfied they are when they are using our system so that we can still improve time to time. Yes.
Like a feedback from the
Yes,
patient.
feedback is yes.
That's pretty good. So anyone, if you're interested, then you can keep in touch with Dr. Beh and also the research team. So maybe just one last question before I pass over to the floor. So what can you share with us? What do you see in this next few years where this telemedicine or digital healthcare is heading to?
Yeah, that's very good question actually. So I think like for our teleconsultation, I think it's still ongoing smoothly, and of course we hope to actually expand to other clinics as well. Because so far I think not all the clinics in the UM is actually doing it. Like now we are having like primary care. I think medicine also doing quite well, and then it's also starting. So I think if let's say all the clinics able to adopt it, then it will be much better. And of course, we do have like the virtual walk run by Prof. Terence. So the virtual walk itself also is something quite big for the hospital, where we do see patients from home, meaning that the patients is at home, and then we monitor their vital signs and all that from the doctors are in the hospital, but the patients at home. So I think it's something we can actually move forward towards. Yeah.
Thank you very much, Dr. Beh, for the wonderful sharing just now. So I believe we all can see how research and technology advancement actually can improve our healthcare system. So before we conclude, maybe I'll open the floor for any questions from the audience. So if you have any questions, feel free to come forward.
I'm Sandy and from College of Health Science. My question is for the consultation session. Was it held during office hour only?
So yeah, thank you for the question. Yeah, it's a very practical question. So yeah, because it's still during the working hour, that the doctors is during their working time. So mainly for Rupa, we are having it Tuesday, Wednesday, and Thursday. So only a morning session at the moment. So you can actually, if let's say you are our patient, then you can actually sort of getting the information from the doctors. Then we can actually give you an appointment on only mainly Tuesday, Wednesday, and Thursday morning at the moment office hour time. Yeah.
our staff might working 24 hours.
Then my mom need more incentive and all that, and for claim or something.
Thank you very much. Okay, thank you for the question. Any other questions?
Good morning, Ben team. I'm Annie from the Department of Pharmacy. May I know what about the charges and how will you sustain this service for long-term purposes?
Yeah, thank you for the question. Also a very practical question. Okay, so mainly for, if let's say for staff or pensioner, you'll be still free because it's already using an existing internet. It's all like existing and already ready. So like internet, all that also is already available in the hospital, which did not require extra cost for that. And of course, like the camera, speakers, all that also like it's already there, existing instrument equipment as well. And then we do have Telehub near to the ENT clinic. Also actually have a camera and all that record. It's already available at the moment. Unless the maintenance, all that might not be really need so much of cost. Quite a simple equipment, camera, all that is quite cheap as well. So those are the things that I think the cost might not be that high. And then the charges for those paying patients, it will be 30 ringgit at the moment. Yeah, 30. But of course, plus with the no need to come for sign a traffic jam, no need to pay for the toll, no need to pay for the parking. So those will be added benefit for the patient as well. Then they can save their money in terms of the patients. For our hospital itself, like I mentioned, that all the equipment and all this is quite rather cheap and also existing internet. So all this no extra like long-term charges and all that. Yeah. So you can welcome your family members or your patients to actually join us also. Yeah.
Thank you, Dr. Wei. Thank you also for the question. So we can see that it's not actually saves in time, but it's also cost effective.
Yes, correct. Cost effectiveness. I'm actually doing another study for cost effectiveness. Yes.
Yeah, other questions?
It's not from CIC. So from my understanding, this medicine is focusing only on setting for diseases for clinical disease. So what about the specificity such as psychological consultation? Can you provide that as well?
Okay, that's also a very good question. So far at the moment, because if we were to start this service, we have to report to Arahan Kerja, we have to prepare like a protocol, Arahan Kerja, and then discuss with the team, and then discuss with the pengurusan to approve it. So what we have it for currently for Luka and other clinic like medical and all that, just simple for medical condition at the moment, like diabetes, hypertension, cholesterol, yeah, simple. So for the psychiatric and also psychological part of the assessment, so far have not been uptake by the psychiatric clinic yet. So if let's say they do wanted to uptake that service in their clinic, then they might need to sort of having some protocol to specify like maybe unstable patient or maybe newly diagnosed patient and other schizophrenia, all that might not be safe to use a teleconsultation. But let's say those patients they are quite stable and whatnot, maybe can consider. But they will need to discuss with the team again whether how ready is their doctors and also how ready is their patient as well. Then actually have a protocol and then discuss with the bigger team, then to approve and to agree and approve. I would say it still needs some planning. But it's actually something it's good to consider as well because maybe some patients they might need this service, they will be good, yeah. And also, I also got another study, also going to look at the empathy of the consultation, like whether, because sometimes we know that teleconsultation might be like, quite fast, like, I just see you and then, you're stable, then you're well and all that. Of course, we wanted to look at the communication of the doctors as well as the empathy of the doctors to patients as well during clinic consultation. So those are the things that we wanted to assess in one of our research also. I think good suggestion can, maybe we can discuss with the secretary team also about that. Yeah, thank you.
Maybe in the next few years, we can already have in our secretary, right? Any other questions? No.
Does doctor order further examination or prescribe medicine to the patient?
Okay, good. So for medication, yeah, sometimes we do have some patient, we interview the patient in our study. So sometimes the patient said that they actually did not know that there is a service that they can actually deliver their medication to home. So there are certain medication as soon as can be delivered, actually they can be so the teleconsultation, meaning that the patient, when they see the doctor through the screen, they don't need to come in to collect the medication. The doctor will prescribe online, and then it will also appear in the patient journey app as well. And then the patient need to online register for the delivery of the medication. They actually deliver to the patient. They can pay online or pay by cash also can. So there's a service that is available to complement the teleconsultation. And otherwise, then be the purpose that I see doctor on the screen, but I need to come to collect medication. So macam be the purpose of teleconsultation. But for blood test, no choice. Blood test patients they have to come here because nobody is going to take blood for them at home. Yeah. So the blood test they must still need to come here, ambil darah, then they balik rumah, and then the next week they see doctor and medication is through online. Yeah, so it's really easy for the patient. I do have one teacher, the patient, she was very excited when having this. She said it's so much saving of her time. Then she said even medication so she can just deliver to her house. So she really liked it. It's our regular customer. Yeah.
That's also include in the telemedicine service package.
Yes.
Bring the truck. Yes, thank you very much, Dr. Megan. So thank you very much for your questions. Any other questions from the floor?
Hi, good morning. You talked about informed consent a while ago. I just wanted to know if the informed consent is done face-to-face or online, and if it is done online, how are you ensuring that the informed consent is meaningful and that they are really consenting to it without any pressure? Thank you.
Okay, yeah, that is a very big challenge for us actually. So when the first patient, the patient first come to the hospital, they will need to sign the consent form first because through the act that we have, the telehealth act which was like a long time ago, the act is stated there that they need to be physical consent form. So that's why so far we're still discussing with the legal team whether can we have e-consent form. Because otherwise, the first time the patient came here as a visit, they still need to sign the physical form first. Then only they can be recruited in the telemedicine. So in terms of they still need to be here physical at least one time. Yeah. Otherwise, we don't have e-consent yet. So meaning that they cannot be just straight away, I want to see teleconsultation. Then they just sign consent, e-consent. So far we don't have that service yet. But we try to, we discuss the legal team and try to see whether how best we can actually adopt this.
Currently, we are practicing a lot of English. Answer questions. Thank you very much. That's very important. Very important. Any other questions from the floor? So then, before we conclude, then thank you very much once again, Dr. Gray, for the very insightful and also inspiring us with your journey towards the advancing the telemedicine, especially in nursing. Please give a round of applause to Dr. Beh Hooi.
Thanks.
Thank you very much, Doctor. So before we end, we would like to present Doctor with a token of appreciation as a gratitude from CIC. Thank you once again, Dr. Beh, and thank you very much, everyone, for the thoughtful participation and also joining for this session. So do stay with us for the upcoming dialogue letter at 3 o'clock for the topic AI-based radiotherapy in common cancer by one of our incredible speakers. So do not forget to fill up your attendance and also collect your refreshment at the right side of the venue. With that, enjoy the rest of the UMMC 57th anniversary celebration and have a good day.